Actually, everyone has already have access to the COVID-19 vaccines since many months ago. Because COVID-19 vaccine, there are two kinds. First is what I call social vaccines. Hand washing, hand hygiene. Don't touch your face. Use face mask, social distancing. These are social vaccines. There is no need for clinical trial. It's efficient, effective. So everyone has already had equal access. It depends on you. Okay? Now, if you want to talk about biomedical vaccines, there are movement globally by Gavi, the so-called COVAX facilities, COVAX AMC, for a low-income country and self-financed country. So if you apply, you have a chance, equal chance, to have access to these biomedical COVID vaccines. But they may not be as good as those social vaccines. Well, for those who join the COVAX facility of Gavi, there are about 90 countries who will receive subsidized price. The rest, they are priced based on their income. Like Thailand, if we are upper middle income, we have to pay higher than the low middle income. Some of the low middle income are also in the COVAX AMC, which they have even more subsidized price. Those low income may not have to pay anything. And they all have equal access to any vaccines that are successful under the COVAX facilities. The COVAX facilities will offer those who are self-paid and join their advanced market commitment once each vaccine comes out with specific price. And then the country can decide whether they want this vaccine or not. And that is the possibility for HTA. But you have to understand that every country wants to have access to the effective vaccine as soon as possible. When it becomes political situation and may not consider much the cost effectiveness or even the budget impact. If neighboring country all have vaccine, but your country is still not, because you still say that it's not cost effective, the people may not be very happy and the government will be in trouble. So HTA plays some roles, but not all the roles. They have the allocation framework by the World Health Organization. But I think the most challenging for the country is how you can roll out the vaccines efficiently and timely, because you need, some of them need intensive cold chain and good delivery system to ensure that this vaccine reach the highest priority group first. So vaccine delivery system in each country is very important, and they need to be prepared. And we should also remind ourselves that we don't know yet whether one vaccine will cover our lifetime or you need it every year. No one knows yet. So we have to wait and see. If there are vaccines out of this list successful, their target is to have 2 billion doses. 2 billion doses. If it is 2 doses per person, then it covers 1 billion people out of the 7 billion, 8 billion we have, which should be able to cover the most needed like the healthcare workers, the security workers, the vulnerable groups. And then after next year, when they have 2 billion, they'll gradually expand more. And there'll be hopefully more vaccine on the market. Then if there are more vaccines to choose on the market, the vaccine price will come down.